back to the East Health TV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, comment, share, and subscribe. And please do come back for more. See
Hey
you
everyone,
soon.
and welcome to The Explainer. I am so thrilled to have you here today. In this explainer, we're going to decode a topic that pretty much everyone encounters at some point in their lives, but we rarely talk about it until we absolutely have to. We are talking about the causes and symptoms of armpit lumps. My goal today is to give you a crystal clear understanding of exactly what's happening under the surface. We'll be relying on the best medical literature out there so you can walk away feeling totally informed and, more importantly, empowered. I mean, we've all been there, right? You're in the shower, or maybe you're just getting dressed, and suddenly your hand brushes against something that definitely wasn't there yesterday. Cue that immediate stomach-dropping panic. Finding a sudden lump in your armpit can be incredibly surprising and, frankly, terrifying. But hey, take a deep breath. Today, we're going to replace that panic with pure, actionable knowledge. So here's how we're going to break it down today. First, the anatomy of the armpit. Second, common and harmless causes. Third, hormones and immune triggers. Fourth, rare but serious causes. Fifth, red flags to watch out for. And finally, your action plan and treatment. Let's get right into it. Okay, starting with part 1, the anatomy of the armpit. It's way more than just skin. So the medical term for your armpit is the axilla, and it is actually a highly complex, incredibly busy biological intersection. It's got fat tissue, sweat glands, blood vessels, nerves, and sometimes even a little bit of extra breast tissue. But most importantly, it is literally packed with a collection of lymph nodes. Think of these as little bean-shaped organs that produce lymphatic fluid to help your body fight off infections. Because you have so many different, totally normal, everyday bodily structures packed into this one tiny area, a lump can easily originate from basically any of them. Moving right along to part 2, common and harmless causes, the usual suspects. First off, the vast majority of armpit lumps are totally harmless. The absolute most common cause? Swollen lymph nodes. This is literally just your immune system doing its job. It's fighting off a simple cold, the flu, maybe a minor infection, or even reacting to a routine vaccine. Eventually, they just shrink right back down to their normal size. But it's not just lymph nodes. Honestly, things like frequent shaving, scented deodorants, or hair removal creams can easily irritate the skin, causing ingrown hairs and boils that feel exactly like dangerous lumps. There are also skin conditions like hidradenitis suppurata that create sore patches you could easily mistake for a lump. It's actually super helpful to clearly contrast two other really common, completely harmless causes, cysts and lipomas. They sound kind of scary, but I promise they really aren't. A cyst is basically just a small, fluid-filled sac right beneath the skin. It has this firm but slightly squishy texture, and it grows very, very slowly. It is completely harmless, unless, it gets infected. On the flip side, we have lipomas. These are non-cancerous, fatty lumps. Unlike a cyst, a lipoma feels incredibly soft, almost doughy, and it easily moves around when you press it with your fingers. They typically take months or even years to develop. All right, on to section 3, hormones and immune triggers, internal shifts. Sometimes an armpit lump is actually being driven by your internal systems. Take hormonal triggers, for instance. Natural shifts during menstruation, pregnancy, or breastfeeding can cause your underarm breast tissue to feel fuller, sore, or kind of lumpy. And actually, that's often more prominent on just one side. Then there are autoimmune triggers, like lupus or rheumatoid arthritis. This is where an overly sensitive immune system creates swollen nodes, and it's usually accompanied by fatigue, rashes, and joint pain. That is exactly why doctors will often run blood tests rather than just treating the individual lump itself. They want to see the whole picture. Which brings us to part 4, the rare but serious causes. This is when to really pay attention. Now, we do need to talk about the serious stuff. In some cases, an armpit lump can actually be the very first sign of breast cancer. This happens because breast cancer very often spreads first into those axillary lymph nodes we talked about earlier. This type of lump usually feels entirely different from those squishy cysts or movable lipomas we just covered. It typically presents as a single, firm, hard area, or as a painful thickening that literally extends downward into the breast tissue itself. Another really serious cause to be aware of is lymphoma, which is a cancer of the lymphocytes, your white blood cells. Remember when we learned that the armpit is basically packed with lymph nodes? Well, because of that exact anatomy, lymphoma can sometimes start right there. The absolute key differentiator with lymphoma is its high growth potential. The affected lymph nodes will typically enlarge very quickly, presenting as a rapidly growing, noticeably large lump. Okay, section 5, red flags to watch, the warning signs. So the crucial point here is knowing exactly what to look out for. First, we need to look at how the lump behaves over time. This timeline is incredibly important. On day 1 of finding a lump, it is totally normal to just watch and wait. Don't panic. But the 2 to 3 week mark, that is your red flag threshold. An armpit lump that lasts more than 2 to 3 weeks and keeps getting worse without any apparent infection or bodily stressor is a classic presentation of a condition called lymphadenopathy. And at that point, you should definitely not delay a doctor visit. And it goes without saying, but if a lump is growing rapidly within just a matter of days, you need to seek immediate evaluation.
Next up, you really need to monitor for accompanying systemic symptoms. Even if the lump itself seems casual, if it shows up alongside any of these full-body signs, you should not hesitate to get it checked out. We are looking for fevers, night sweats, unexplained weight loss, or this general, unshakable tiredness and fatigue. Basically, these signs suggest your body is fighting a much larger systemic battle. Right back to back with those full body signs, we have specific, localized visual changes on the breast skin that should never, ever be ignored. If you have an armpit lump and you simultaneously notice things like redness, dimpling in the breast skin, a strange thickening of the skin, or if you see your nipple pulling inward, you must see a physician. If you go in, your doctor will likely perform a detailed ultrasound and possibly a needle biopsy to properly figure out what's going on with those visual changes. If you go in, your doctor will likely perform a detailed ultrasound and possibly a needle biopsy to properly figure out what's going on with those visual changes. There's a quote from the medical literature that I think really hits the nail on the head here. Think back to that harmless lymph node reacting to a cold. It swells up and then it naturally shrinks back down in a normal infection and repair cycle. But a lump that is hard, fixed firmly in place so it doesn't move when you press it, is completely painless and just keeps growing, that is a definitive warning sign that requires a specialist's evaluation right away.
All right, our final section, part 6, action plan and treatment, what you can actually do. Well, you literally can't prevent every single armpit lump. I mean, many are just normal body mechanisms doing their job. You can absolutely massively lower your risks. Step 1, shave gently to avoid irritating those follicles. Step 2, keep the area clean to stop bacterial buildup. Step 3, if you see a skin issue developing, treat it early before it becomes a deep boil. Step 4, track your vaccines. That way, if a lump pops up a few days after a shot, you know exactly why it's there. And finally, step 5, be proactive and get your regular breast scans. Now, if you do develop a lump and head into the doctor's office, here is what might happen. For a lot of small, soft, harmless lumps, the prescription is quite literally just watch and wait, while maybe applying a gentle, warm compress to ease any discomfort. If there's a bacterial infection, antibiotics are going to be used. Pain can easily be managed with anti-inflammatory medication or creams. For really stubborn cysts or abscesses, a minor drainage procedure might be done. Or honestly, your doctor might just suggest changing your deodorant or your shaving routine. The treatment is always highly individualized. So to wrap up our whole explainer today, remember an armpit lump is overwhelmingly likely to be completely harmless. It's usually just a cyst, a minor infection, maybe some shaving irritation, or a benign fatty growth. And they often go away entirely on their own. But the absolute vital takeaway is this: a hard, growing lump that is fixed in place, especially if it's accompanied by systemic signs like a fever or weight loss, should never be ignored. Being vigilant gets you the right diagnosis and the right treatment much sooner. I want to leave you with one final kind of provocative thought. You really can't spot a red flag if you don't know what your normal even looks and feels like to begin with. So are you actively tracking your body's baselines? Taking a proactive, active interest in how your body operates day to day is literally the ultimate tool you have for your own long-term health. Thank you so much for joining me to decode this topic today. Keep learning, keep observing, and absolutely stay empowered. Catch you next time.
Please subscribe.